Hello, my name is Isaura Gomes and I will present you the work titled IL-6 serum levels are correlated to severity in rheumatoid arthritis. Let's go started! Firstly, it's important to say that rheumatoid arthritis is an autoimmune disease that promotes a progressive joint damage and leads to increased disability of patients. Some studies indicate that approximately 50% of patients stop working 10 years after the onset of illness due to pain and disability caused by arthritis. Many of these effects are caused by unregulated cytokines in the disease. One of the cytokines involved is the interleukin-6. Anti-IL-6 therapies already exist, but is only used on the patient when other therapies fail. In Brazil, it's not established to verify the serum levels of cytokines before treatment, although therapeutic failure may affect the patient's quality of life and decrease life expectancy. Some researchers suggested that the persistent inflammation in patients with rheumatoid arthritis can be due to the right IL-6 levels in serum, and in these patients, an IL-6 therapy will be more effective. So, my research group decided to verify if IL-6 levels are correlated with worse disease activity measured by CDAI and DAS28 indexes in patients being treated. We collected blood of 44 patients with rheumatoid arthritis and measured IL-6 levels using a CBA technique in a fax caliber flow cytometer. Our patient group had a well-established arthritis once they had a mean age of 10 years of disease duration and a mean age of 53 years. All patients were under treatment and 57% were on synthetic drugs that decrease inflammation as a whole, while 43% were treated with biological drugs that have a specific target, like an anti-NF or anti-CD20 therapies. The IL-6 level was increased in 34% of patients, and it was positively correlated to activity indexes, indicating that the higher IL-6 level greater the activity of the disease. In general, IL-6 showed highest levels in patients with worse clinical response, independent of therapy. According to this, we suggested the use of IL-6 serum quantification tests before choosing treatment for the patient, since IL-6 inhibitors can be more effective.